There we go.
Oh,
Yay.
thank you so much for everyone's patience. I've never had
Of
that happen before.
course.
Wonderful. Well, hello, I'm Kelsea Green. I'm a speech pathologist and orofacial myologist here in Newcastle. I'm actually in the Munchie HQ today, which is lovely to be here.
Nice.
But yes, we're going to be having a chat about spotting those early signs of oral dysfunction. But I am joined, as I've briefly touched on, by Dr Lynda and Dr Krystle Dean-Duru, who are mother and daughter team, which is incredible, and dedicated to advancing those children's oral health through integrative and holistic dentistry, which is amazing, and very excited to have you here. So with over 2 decades of experience each, they combine innovation and compassion to support airway development, which is how I like to think that I'm moving forward in this world too. So developing sleep and overall well-being of those children and patients that you see. Together, they empower families to nurture healthy smiles and brighter futures. So thank you so much for joining me. We'll jump straight into it though, I guess, not to keep everyone held up any longer. But I thought, so we really want to touch on those oral habits, mouth breathing, drooling, fussy eating, and a bit on sleep today. So my first question, whichever one of you want to take it, when you see little ones in the dental chair, what are some of those early signs that tell you their oral development might not be tracking as it should?
Yes, thank you so much for having us. This is amazing and so important for us to get the word out on those early signs. And for us, when we're looking at patients, we're really looking for patterns of growth. So typically parents are asked, is everything all right? And you say, yeah, of course the teeth may look fine, but there's some early signs of dysfunction that shows up before cavities, it shows up even before crowding appears, that affect how a child's going to grow, breathe, and eat and sleep. And so starting, when they're very young, you can tell from the ways the cheeks look, if one cheek is more fuller than the other, or if the chin is starting to lengthen or be retruded, things like that. And so there's some subtle asymmetries that often give a sign and reflects how a child is breathing or swallowing, things like that. Narrow palates or narrow arched palates, high vaulted palates. So it's like the shape of the palate and how far it's going into the nasal structure and things like that. Then we go into how they're even sitting, posturing in the chair. Are they slumped? Are they sitting well in the chair or laying, or are they fidgety, things like that. And then very importantly, their oral rest posture. If their mouths are just sitting open or at rest, you're not doing anything, their tongues are laying low, it's hard to close their lips, and you can tell that it's difficult for them to keep their lips closed. If you can hear audible breathing whilst they're just there sitting and you can hear them breathing, it's showing that there's effort occurring and things like that. Let's see, other things. If we talk about their feeding patterns and things like that, and parents tell us from questioning, those give us a hint if there's been weak suck or just weak eating and things like that. So yeah, there's a few things that we get a lot of hints from that we actually are able to watch and see before we even looking at teeth or the shape of the jaws.
Yeah, and I find that as a speech pathologist too. It's not necessarily why they're there to see me, but spotting those signs of dysfunction and opening that, I guess, sometimes can of worms, but also just educating and highlighting those things. One thing I do find in practice is often that comment of, oh, it's normal, most kids have it or they'll grow out of it, particularly when it comes to pacifier use or thumb sucking and mouth breathing and drooling. So this one's for you, Lynda. In early childhood, when do these become red flags for you? So we're talking, pacifier use. When are they red flags for you?
Okay. Let me just put it out there, the disclaimer. I'm not a big pacifier fan to start with, but I understand when parents have to use it for their mental health or if a baby is born premature. I know there's some places for it. So, but the parents, most providers will tell them, oh, it's just a phase, just like you said. But usually that's telling us that there is something that their body needs, and we need to figure out what that is. So
Yeah.
when I see the pacifier use or thumb sucking habit that has gone beyond 18 months to 2 years of age, you know that already they're going to be causing problems with how the jaw grows. So it becomes very important to get ahead of that, and so that you avoid the narrowing of the jaws, the flaring of the teeth, and changing how the lips and the muscles work together.
Mm.
So that's really important. So when we see that mouth breathing or drooling, occasionally if they're ill, maybe they can breathe a little bit through their mouth, or a little bit of drooling when they're feeding. But if
Mm.
that's persistent, that's telling you that the oral posture is not where it needs to be. And it could be structural, there's some blockage in their airway, or it could be because there's some neurological something that they need and not quite getting that coordination like they should. So
Mm.
usually above 2, then you really need to investigate it. Because if a child can't comfortably sit with their lips together, then the parents should worry, because the oral posture is very important on how the face grows. And persistent mouth breathing is a big red flag. And that's something we want every parent to be aware. Or even snoring, even. That's not normal. They're not supposed to do that. So if a child is using a passy or dummy, in Australia, you guys call
Mm.
it dummies. And I think in
Yes, I
England too,
changed my wording.
they call it dummies. But they're pacifiers around here. The persistent use of pacifier, really by 6 months of age, they should be getting rid of it.
Mm.
And if they can't get rid of it, that tells you that it's hard for them to transition from the reflexive swallowing of an infant to a mature swallow, which is what helps to grow the face. So very
Yeah.
important. So
No,
parents should be on
definitely.
the lookout for that. Mm-hmm.
Yeah, and that's where I guess I'm
The,
very creative. The BB was hopefully that pacifier swap out, and I do that a lot.
yes,
In the last 2 years, I've worked a lot more in the pre-2 age group, and
yes,
I also learn a lot from my own daughter with the BB. We've just transitioned
yes.
to a mini, which is very
Oh,
exciting.
nice. Yes,
But yeah, no,
yes.
that's great. I do want to highlight too today, if you comment chew, you'll get access to the Why Children Must Chew guide, which is all about this. So we're identifying those signs today, but also why would we add in chewing to support those signs of dysfunction. So if you
Mm-hmm.
want to comment chew, you should get access to that Why Children Must Chew guide, which is great. Um, I guess, and then on chewing, fussy eating, and
Mm-hmm.
as a speech pathologist here in Australia, we work with fussy eaters, and can be those difficulties with certain textures, but sometimes that's an early indicator of oral dysfunction. It's not just a sensory preference or avoidance. So, what patterns do you notice that parents might overlook when it comes to fussy eating and foods?
Oh
Krystle?
yeah, so that's such a great transition because feeding is so important. Feeding is where everything starts, right?
Mm.
So how a child starts to eat tells us a lot about their muscle tone, their coordination, their sensory system, and even airway comfort. And so when parents say they're just a picky eater, we're really what we want to do is ask, okay, what's their mouth trying to tell us? If they're
Mm.
preferring puree foods or soft foods past toddlerhood, they may have the weak jaws, poor coordination, or just a discomfort keeping their mouths closed while they're eating, right? Trying to choose between breathing and chewing. So
Mm.
it's not always a behavioral problem. It could be a functional issue or a functional challenge. And then there are kids who are avoiding certain fruits with skin, right? Or certain meats that they can chew, and that could reflect an airway discomfort as well, or sensory issues. And a lot of times, mouth breathing kids find those mixed textures very difficult, because again, you're trying to manage breathing, swallowing, chewing, all types of things. There's a lot of things that you have to coordinate when
Mm.
you have to chew tougher foods. So that's typically those are hints. So if we're limiting chewing if we're limiting chewing, then we're limiting the jaw stimulation and the tongue to palate contact, which is extremely important in building the face, but also coordinating muscles, coordinating the sensory system, and further on creating good optimal facial growth and airway. So every bite is extremely important exercise for the face and for the sensory system and the brain. So typically parents should watch out for, if their child is pushing the food towards the front or pushing their tongue towards the front when they're eating, or eating to one side only, or of course just preferring those soft processed carby types of foods, gulping instead of chewing. And oftentimes parents are having to tell kids to close their mouths when they chew. It's like the kid is suffering, but it's the parent is like really upset. It's an indication that something's going on. So breathing through their mouth, or eating really fast, or eating really slow, those things parents should really look out for. And those are the kinds of signs of the oral motor imbalance that we also take a look at and observe to know that we need to intervene. So it's not just a phase as far as picky eating.
Yes, no, definitely. And when it comes to those muscles, and I talk all the time about living with a softer diet, and someone often asks me, why do we have to outsource chewing to a device like the myologist? And I'm like, because we, particularly in Australia, I believe, we have beautiful quality, even our meat. So even if you're eating meats and chewing these chewier foods, they're still beautiful quality, and that makes it softer. We just don't chew enough anymore. So I love that. And I often talk to my fussy eater families about meal times might be for those calories and getting food and nutrients into them, but snack time is a beautiful time to develop their jaws. So like my daughter loves a bag of biltong, like beef jerky. That's what she snacks on in her lunchbox throughout the day, or those chewier things as snacks. So because fussy eating, is when they're overwhelmed by food. So let's do it when they don't have that demand on them as well. No, that's amazing. Thank you for that information. So I'm also very passionate about sleep because of the impacts it can have just across so many areas. And I know the dentists around here and the dental world are very passionate about this area now, which is very exciting. So sleep disturbances or snoring, we touched on that a little bit before, can have significant dental and airway implications. So what advice would you give parents who are starting to notice sleep changes, or what are they? What are some sleep disturbances other than snoring, and what advice would you give?
That's a great question, because you're really asking, why does sleep matter? And so when a parent tells us that their child is snoring or tossing and turning at night, I don't just go, oh, that's a bad sleeper. We start thinking immediately, what's going on? They're probably just not getting enough oxygen. Their breathing is not right. And sleep is when growth and repair and a lot of the learning get consolidated. And so anything that disrupts sleep will make it harder for the child to be able to grow to their best potential. And so most of the time it's improper breathing, or them not being able to breathe as well as they could. And so that will affect how their development occurs. When they're snoring, it is never normal in any child. So again, I said earlier, if they're sick, maybe they have a cold, that's understandable as a physiologic thing at that point. But persistent snoring is not normal. That just tells you that air is moving through a narrowed space. And that often sometimes from enlarged tonsils and adenoids or an underdeveloped jaw. That jaw is not big enough to keep your tongue in properly and get the tongue to palate contact. And it's easier for it to fall back a little bit when you're sleeping, really. And so restless sleep or odd positioning is an effort for the body to restore balance. And it's important for us to take a look at that and investigate that a little bit further for a child. Not breathing, and when the mouth is open, it lowers the tongue. So if they're sleeping most of the night, the tongue is low, that's going to narrow their palate. That's going to elongate their faces, and that child is breathing at night, And the nighttime good breathing at night is what helps to shape the face. And just like Dr. Krystle said earlier, and when your face grows more forward and wide, you have more space to breathe as well. That grows your airway. And that's why it's so important for us all, providers and parents, to be able to be on the lookout for that. So for a parent, if your child is snoring or mouth is open all the time or persistently restless, and we recommend that you seek help. If someone tells you they're going to grow out of it, do not believe them. You don't grow out of it, you grow into it. And so usually you get the help of a knowledgeable pediatric airway functional pediatric dentist like us, or get to an ENT, have them check their tonsils and adenoids, maybe an allergist, have them make sure there's nothing that's in the air or in the house or something they're allergic to that could be causing them to not sleep well, not breathe well, and inadvertently not sleep well. But the great news is when you identify these early, they're very easy to correct, and you can keep that child moving in the right direction because you are empowering their bodies to grow its best. So restful sleep means better jaw growth, less braces, and better development overall.
Yeah, no, incredible. And I often say, and I got this from someone else, I can't quite remember who, but the quote of it's considered sleep disordered breathing, but maybe we should consider it to be breathing disordered sleep.
Disordered sleep. That's
Absolutely.
And I just feel that
I think it's Roger Price. Roger Price and
yes,
Dr.
yes.
And Dr. Barry Raphael. They're the ones that always say that. And I kind of say, it's not only at night. They're not breathing well during the day, and that just translates through at night as well. So actually, speaking of that, so the way parents can identify it if they don't already know is to go, of course, watch them when they're watching TV, but when they're actually supposed to be sleeping, go into their rooms, look at them, and watch closely. Make sure they're not moving around, they're not in any odd position, butt in the air, or have to kick the covers all over the place. But there's no noise coming from there. Breathing should be silent. And also look closely at their faces, because mouth breathing is not usually that Napoleon Dynamite kind of open. Sometimes it's just ever so subtle. The lips are not closed. And so just look directly into their faces to make sure that the lips are sealed, because that's how we're born to breathe. We're born obligate nose breathers, and mouth breathing, there's nothing good about mouth breathing.
no, definitely not. Yes, that's and that is those early referrals off to the people you mentioned, and just trying to work out what might be going on can make such incredible change. We did have another question come through just while we've been on about baby being born with tongue sometimes sticking out. Had trouble latching, now 8 months old, and doesn't really like purees. So would this be signs of oral dysfunction to you, or what? Yeah, would you like to?
Yes, those will be signs of oral dysfunction. Your tongue's not supposed to be hanging out. And again, before they're 6 months old, they have reflexive swallow where the tongue is going back and forth, helping to push milk down and getting them to swallow correctly. When their first teeth coming in the front, there's time for the tongue to start going toward the back, moving in a more peristaltic fashion. And that's called, part of that is the anterior coupling reflex. And that's important because you're setting up your nervous system, getting ready for the molars to come in, and then their posture upright. So nature has laid everything step by step on how they need to happen. And the good providers are not trying to force things to happen. They're looking to see what in nature do we need to help? What imbalances are there, and what obstacles are there that you can gently just nudge out of the way, especially when they're young. When they're young, you have the ability to gently nudge them away. before they get to be older. It gets more difficult as they get older. So yes, that will be something that we're definitely concerned about, because the mouth open, lips, tongue hanging out means they're definitely breathing through their mouth. They're not going to be nasally breathing, and they're not going to be able to naturally widen their jaws. And of course, purees not helping to stimulate jaw growth either. So yeah.
Yes, and I think that's where I was going to touch on those purees, like possibly introducing more solid foods or stick long foods, or getting like the baby munchie in their mouth to get that oral awareness, stimulation, decrease any of those primitive reflexes that might still be there, get
Exactly.
them chewing and lateralizing that tongue, because then purees, they might not like them, they might not feel safe eating them. And that's something I often talk about. Our body will do everything to protect that airway. So if the mouth's not doing what it needs to do, it might not feel overly safe. But that's great
Yeah.
information. Yeah.
Yeah, but it really is supposed to be going from milk to solids, not really going from milk to purees. So they get from milk to solid, get that anterior coupling reflex, get that peristaltic swallow going, then they can handle the purees. But most people are doing it backwards. And again, if that child has not been having tongue to palate connection, then the roof of the mouth is not quite aware, doesn't quite know, oh, I'm supposed to feel this way. So the nervous system is not exactly ready. And that gets them a little bit less comfortable being able to try different foods.
Yeah, no, definitely. There is actually quite a few questions just coming through now, but there is one. Both my baby and toddler sleep with their butt in the air. My toddler has dark circles under their eyes and is an occasional mouth breather. So what would you say might be needed, or who might be needed for this one?
Well, if she were here, we would say come to us first. And that's because then we can quarterback. We'll do the investigation for you, figure out, okay, who do you need to go see first? And there's certain, I don't want to say simple things that we get to first. We want to make sure that they are able to breathe through their nose. There's some exercises we start first to see that, okay, they can actually breathe through their nose, and get some nasal hygiene in. And, within 4 to 6 weeks, we'll know for sure. And at that point, then maybe you can go there, be the ENT. And the ENT can look to see if the tonsils and adenoids are enlarged. And even if there are, really, the fact that you now have established nasal breathing becomes more important, because sometimes the mouth breathing is implicated in the enlargement of the tonsils and adenoids. Of course, there are other reasons. Sometimes it's allergies, sometimes it's inflammation, but at least start from there. And if you have a good functional pediatric dentist, then they will know when to send you where and be able to coordinate that care. Because the only way growth happens like it should is from collaborative care. There's not one thing that does everything, and the good provider will understand that. And some people will just rush to doing rapid palatal expander. We're not all symmetrical, so really that's not always the answer. And so you want to start the simple things first. And even if you needed to make room for that tongue, do it in a manner that is more physiologic and a little bit more gentle, so that the body is able to receive it better.
Yeah, definitely. And I see myself in that role at the moment. It's almost like bringing all the puzzle pieces together and making sure there is someone overseeing that collaboration as well. So, yeah, and I think that's the whole philosophy behind the munching movement. Like, we want that collaboration, we want the community amongst practitioners, not just all these parents out there. Incredible. Like, I often say that the population, the people, are ahead of often the professions, and they're seeking this information themselves. So to have this collaboration amongst professionals to support these families is so important. We had another one about, oh wow, lots coming through, sorry. Advice to stop thumb sucking. So we might just do 2 more, so I can let you ladies get on with your afternoon. But so advice to stop thumb sucking. Do you have maybe 2 quick tips, or 2 or 3 quick tips about thumb sucking?
Well, it would be an exchange. Because you first again, you ask why they're sucking their thumb. They're sucking their thumb most times because they want to center themselves. So first you figure out why they're doing it, and then as you're starting that treatment, then you're also giving them something in exchange for it. If they're looking to center themselves, something like a munchie is a good thing because it's got the proprioception in it. So when I say center themselves, getting that, they're trying to push on the roof of their mouth because probably their tongue is not reaching there to get direct access for their pituitary gland to release dopamine and serotonin that help them feel good. And so start the process of figuring out that. How can you get them to do that? It could be getting to make sure, depending on what their birth story is, it could be going to see the osteopathic physician or seeing a baby-friendly chiropractor like Mary, and getting you involved in the feeding and things like that, and getting us involved as well, getting a structural functional person involved to make sure that all of us are protecting her psyche. Because you can't suddenly just go, boom, stop sucking your thumb. And if anybody who does that doesn't understand the development on what's the reason is why they're sucking their thumb. And so the advice will be start figuring out why. Let's go back to the history. How did the baby come into the world? Were they a C-section baby? There was a labor fast and ignition didn't get turned on. Was labor hard for that baby? How was their latch? So you just go work backwards, ask all those questions, and then start the process gently. It's got to be gentle. If they're able to if they're at the age where you can negotiate, find out what they want. And it may not be something you like, but it is what they want. So you got to help her get what she wants so she can do what she needs. And so that's usually how it works. That's usually how it works. So it may not be something it may be something you don't quite like, but if she wants it, you need her to stop sucking her thumb. So kind of make a deal on that as you're physiologically helping them to become more centered.
Yeah, no, I love that. That's great. Yeah.
Thank you.
Okay, I think lots of we wish you were in Texas and wish you were where we are. But there's one last one would be young child holds their breath while chewing or having a big drink, and then sighs or takes a big breath after chewing and having a big drink. What do we think is going on here?
Dr. Lynda, yeah.
They probably have a lot of issues going on. I beg to say they probably have an underdeveloped jaw as well, and a nervous system that is just not grounded yet, probably in a lot of sympathetic overdrive, anxious. And again, it goes back to finding out the history, what's happened to this baby, what happened when the mom was pregnant, what was pregnancy like, what was breastfeeding like, and you help them get through it. A lot of times when you have that part during birth, the back of the head takes a lot of the brunt of birth, and very important nerves are coming out from there. One of them is a vagus nerve. We all know it goes all the way down to rest and digest. For us, the most all important, but getting the hypoglossal nerve, which controls the tongue, and there's so many nerves right at the back of the head. So if there's a lot of imbalance there, it's very hard for your nervous system to be coordinating and growing like it should. So a lot of times these kids are they're like a computer with so many tabs open and music playing in the background, and they don't know where it's coming from. Actually, I think it's Dr. Tenholder who describes it like that, but we love it so much. We use it all the time. And so we can't know. And so all of those are like, okay, which do I do? Do I breathe? Do I keep? Do I eat? Do I swallow? Do I chew? Do I breathe? And breathing's always going to trump everything. So if your brain is so busy trying to get you to breathe, get in oxygen, you don't have the resources to do everything else that you need to do. So that child really needs to be helped. Somebody needs to figure out why and help him or her so that she could start closing some of those tabs, getting rid of those obstacles so they can grow their best. It doesn't go away. It actually gets worse. Sometimes some parents come to us and they say, oh, he was doing it, but it stopped. No, it didn't stop. Something else started happening, which you may not know now. So it's like robbing Peter to pay Paul. Someday, Peter is coming for pay me back. So we cannot ignore those signs and symptoms when they're young. They don't grow out of them, they grow around them. And it stays with you into adulthood. That's why there's so many of us that are not well. And they start from early childhood. And the sooner we recognize that, the healthier we can get our children to be.
And just a note, that was really good, Dr. Lynda, because just a note for parents too, as far as how long it'll take to reverse, that the early intervention is extremely important, because then you have less time for those habits to build and cement themselves and cause more compensation. But when you start treatment, one thing to understand is, like, if they're a little bit older or if they have cemented some of those habits, it'll take some time. I think, Dr. Lynda, you have a time period of how long it takes for the habit to reverse and get into a better, more progressive habit. It takes some time. So.
Yeah. Usually I say it's half their age to automate.
Half their age, to automate.
So
exactly.
to automate it. Yeah, they can learn it, they can relearn, you can teach them the new habit, but their bodies always want to go back to where it was. So, but you want it to be automated so that that's just who they are growing up.
Yeah. No, that's amazing. We do have a really great question, another question, but I think we have to leave it there. I'm going to write that one down, though, that it has come through. It's just about a young one who has had sort of done the journey, but still has some of these signs. But I think it's actually something we might discuss in the next few weeks with, other ones. So that's okay, because I have kept you for quite a while. But I just wanted to thank you again. That was incredible and just great information. Thank you for joining me. A reminder, if you comment chew, you'll get that Why Children Must Chew ebook sent to you, or guide sent to you. But yes, thank you again. It was lovely to meet you.
It's our pleasure.
Thank you so much for having us.
Yes.
Thank you.
Say hello to Mary as well.
I will. I think she's online here, thank you. Have a great day.
You as well. Thank you, Dr. Krystle.
Thank you.
Bye, everyone. Thank you for joining
us.
us.
Thank you for joining.